Welcome to the Living a Life in Balance podcast. My name is Abdullah Boulad. I'm the founder and CEO of the Balance Rehab Clinic. My guest today is Dr. Sarah Boss, a psychiatrist, psychotherapist, and clinical director of the Balance. I've known Sarah personally and professionally for over 10 years. She is the most skilled mental health practitioner I've ever met. In this episode, we dive into her 20 plus years of training and experience, integrative psychiatry, genetics versus epigenetics, generational trauma, and the latest mental health techniques that are available today. I hope you will enjoy. Sarah, what motivated you to do what you do today?
Already when I was a child, I was thinking there are few things in life, or that's how it seemed at least, that are infinite. I was thinking the space, the universe, which is incredibly interesting and beautiful thought that it's simply infinite. They're black holes and we can never understand it, or at least not now. There's always something to explore. And then there is the human mind and the nervous system, also infinite. And that's the beauty about it. That's why I thought becoming a psychiatrist gives me about the same as exploring the universe, infinite options, and each person is a universe.
And you wanted to discover the mind or the human. What was your most attracted element in here?
I think it's a combination. I think it's beautiful to be with each individual and feel like everything is new to explore. And you can hopefully take your time to really understand what's going on and to really be able to hopefully help and support. Mm-hmm. And then there's also, I think it's such a beautiful thought that something will never stop. Like all my life until I die, there will be so much to discover, to learn, to be interested in, and not like some other jobs where you do maybe the same every day and you feel frustrated maybe in the evening. That was my thought back then.
Yes. So, but it also means is what we know today about that subject may be shaken up in the future.
Absolutely. Like everything in medicine, it's amazing. Like most specialties, after 2 years, they double the knowledge or triple even. So like, for example, psychiatry now is so incredibly different to the 70s or to 1900 when they were still doing brain surgeries and things like that we can just not imagine anymore. Yes. And it's not that long ago.
Yeah, no. But you didn't just finish being a psychiatrist, saying just. So it's a long study you had to go through. But you went on and went into further educations. Why and what motivated you there?
Yeah, no, definitely. I think in total it was already 20 years of training. So after becoming a medical doctor and psychiatrist, of course, I needed to become a psychotherapist as well. I don't just want to prescribe medication and have limitations there. So I went into the whole field of psychotherapy, which is also incredibly broad if you're interested in it. So there are many different methods you can develop. And once I did that, I noticed that, of course, it's very important, all the talking therapies, and it's beautiful, all the options there are. But still, it's just not enough to really understand a whole human being. So I got into the field of functional medicine and, including nutrition and the brain-gut axis that we knew back then, that is very important and we can't just ignore. And thinking about the microbiome, about micronutrients that might be influencing us. And then I also became a neuromodulation specialist to be trained in modern devices, also part of the future of psychiatry, that we can apply to not prescribe so much medication, or in case medication doesn't work.
Yes.
And then after that, I was still feeling that something's missing. It's just not enough. And then I got into somatic experiencing, which I found the most useful for me to just get the full picture, so to say, which is so beautiful to work with the nervous system without talking much. And that all together, like these 5 trainings, I think are really needed as a psychiatrist today. I wish everybody could have that, and I hope it will be the future for everybody to be trained in those, at least partly, or at least to understand how important each part of it is.
That's amazing. I mean, this is like a full clinical team in one person, what you're explaining. Is there anything you haven't done in the field of mental health, medicine, psychiatry?
Well, I'm sure there is, but I think the most important now that is out there now, I did do. But then the beauty is I don't have to do it all myself. Now we have our great team, but what I can do now is really supervise it well, as I had all the trainings myself.
Orchestrate properly
Exactly.
the experts in their fields. Yeah.
Or can also do the fine-tuning, which is beautiful. Usually I do get clients that have tried a lot of things already in their life. I've seen many different psychiatrists, psychotherapists, and now I can do the fine-tuning, see maybe what could be useful, and see it from an outside perspective also.
Very interesting. Yeah, it's when we look today out in the world, there are misconceptions about psychiatry and mental health. From your perspective, what are these, and what are trends, and what is causing this happen?
Yeah, unfortunately, I think there's still a lot of stigma about it. Like, still a lot of people think psychiatry is something where only, a psychiatrist is somebody that only a crazy person is supposed to see, or that it's something bad to be seen in the office of a psychiatrist.
Yeah.
Or some people also still confuse diagnosis. For example, we still hear nowadays that somebody would say he's schizophrenic because he's changing his mind all the time, even though that has nothing to do with this diagnosis. And so these kind of things I think we still see, and then also I think a lot of fear still, because psychiatry used to be quite rough as a specialty, out of the need also, because people didn't know what else to do. So there are still movies around, where you see people with electroshocks, or with these, tied into those ropes and all kinds of things.
So you can guarantee to me that this is not happening?
This is not happening anymore. We
Okay.
don't like that as much as any patient. It was also traumatizing for the people that had to apply that. And it changed so much. Nowadays, like I said initially, it's such a beautiful field, actually. So human, so kind, so understanding. And actually, it should be something where everybody feels like he could go to if everything else didn't work, or if they just don't feel good at all, like a rescue island, where you're always welcome, like even on a psychiatric ward. That's what the whole meaning of it. You can go there if you feel lost and desperate. That's where people are that can deal with that.
But where is the edge where I feel still okay, I can manage, or I need external help. I need a psychiatrist, or I need a psychotherapist. How can someone find out when is the right time to seek help?
Well, that's a really good question. I think in general, we shouldn't wait too long, because it's our life. Maybe we only have one, and it's our quality of life. So in doubt, I sometimes think if we already think about it, maybe we should go already, because then it tells us something. But of course, we can try first to speak with our family, to speak with our friends, But if we notice, for example, that we're changing a lot, that we, for example, wouldn't do things anymore that we used to like, sports, activities, going out, if we're withdrawing, or if we're not sharing anymore, if we see changes in our behavior and in our quality of life, then I would really go out and seek help, just to not chronify it also.
Yeah, exactly. In today's world is psychiatry becomes a topic once you feel you are at the edge. It's maybe too late.
Yeah, exactly.
You cannot manage life anymore by yourself. So what you're saying is that psychiatry or psychotherapy, mental health in general, will become more also preventive
Yes,
going forward into the
absolutely.
future.
Absolutely.
Like we do sport as a prevention, but with therapy and psychiatry, we don't do that today.
Exactly. We wait way too long. Yeah. Absolutely.
Yeah, yeah.
We should start in schools already. As always, everything we want to change, so we should start with more prevention in mental health in schools. But there is the tendency, like my little son already had yoga in school when they were 3 in a public school. So that is a hopeful thing.
Nice. Are there any other misconception or global mental health problems, issues which are rising?
Mm-hmm. Yeah, I think it's how we use diagnosis, which is also culturally a bit different. Like in some Middle East countries, there seems to be the trend that a lot of people are sent with the diagnosis bipolar, for example, whilst they might have mood swings. Like everybody has mood swings sometimes, but they might have mood swings that are more intense out of another reason without being bipolar right away, or confusion about symptoms in general, or also addiction, when only addiction is seen and not what is really, behind it, usually a trauma, and where the addiction is just the behavior somebody would come with. And then also in other countries like the US or England, there is a rise at the ADHD diagnosis, for example. Everybody seems to have that now, and in every class, a lot of children. And that is also, I think, a trend we're seeing, that people are labeling that sometimes, but where the cause is another one, and also the approach should be another one.
Yeah, so you see clearly, and I can confirm that also when I speak with clients, I can relate to that. So the Middle Eastern definitely get more diagnosed with bipolar or a mental psychiatric disorder compared to someone in the UK or in the US where ADHD seems on the rise. And there I wonder, is it really on the rise because new techniques of diagnosis, or is it on the rise because of other elements happening in the world?
Definitely. I think the second, absolutely. I think it's not for everyone, of course, no doubt that it does exist. But I think in most cases, it is either sleep deprivation or the whole social media, smartphone problem we're facing the last 15 years now, which we see a lot of effect already in our society at every age. And then there is a lot of trauma in the background that if we don't see it, we misdiagnose. Where, for example, ADHD symptoms is a typical way of showing that our nervous system is dysregulated and that we're not safe and that we're not at a resilient place where we should be.
Yes. And looking also at the regional differences, staying there for a bit, I often see also certain tendencies where regionally psychiatrists, therapists rely more on medication intake, medication-based treatment versus more holistic or others. How do you see this development happening regionally?
Yes, that is very, very true, unfortunately. I think it's important to understand that most healthcare systems don't have the money for more time. That's the big problem. Like a usual psychiatrist in many countries has 7 minutes for a client, sometimes 20. But even 20, I mean, how are you supposed to really understand somebody in 20 minutes? Like my first consultation is usually 90 minutes to really understand somebody. Yes. So, of course, you can't offer much in 20 minutes or in 7, imagine. So all you have, and that's what these people are trained with, it's like acute medicine. You have to prescribe to help somehow or to try it at least. So that's one thing. And then another thing that is immensely important is that most psychiatrists are not trained even in psychotherapy. Yes. So I was lucky when I started, I had my training in Austria, in Vienna, and we had a huge change in the system before I started. That was good because they forced back then. It wasn't easy to apply it. Every psychiatrist to do psychotherapy training in their free time, like in the evenings, on the weekends, and pay for it themselves, which is really hard to start. But now it's the most normal thing. So I think these kind of revolutionary changes happen throughout whole Europe now and throughout the whole world. You just simply can't break those specialties apart. It used to be psychiatry and neurology. That used to be one, because back then people in German, we still say that somebody has a problem with the nerves, but they don't think about the nerves in my leg. They think that we have nerves in our brain, only the mental nerves, exactly. So that used to be like 60 years ago, that was normal. Nowadays, it's completely different. Immense specialities we would never put together anymore.
I feel also there is a misunderstanding or a misconcept around which speciality does what. Because people mix up going to psychiatrist with going to psychotherapist or a psychologist or a counselor or a practitioner.
Yes.
Can you explain it in your words how you see the differences between all the specialities or type of therapist?
Yeah, well, a psychiatrist is a medical doctor and has usually 12 to 15 years of training and can prescribe medication. And is usually, until now, more for the more complex mental problems.
Also diagnosis.
Exactly. And then a psychologist has usually 5 years training, and then the clinical part in a hospital 1 or 2 years, and then is there for talking therapies. And if they add psychotherapy to it, then they're trained in one method. Can be, for example, cognitive behavioral or psychoanalysis or systemic therapy. So it's very good to really check what kind of training somebody has, even before starting treatment.
Yes.
To really get somewhere to somebody that has experience and a good training also and a good approach. Not just from an evidence-based side, but also how the mindset is of each method.
You're mentioning methods. There are plenty of methods, and sometimes people or clients, when I speak to them, they ask me, do you offer EMDR? Do you offer systemic therapy? Do you offer DBT and CBT and so on? So what is the minimum qualification a psychotherapist, a good psychotherapist should have for someone to trust to go to? And what are the type of treatment specializations, more the modern world practical?
Well, I think what we know from evidence studies also, and in general from our experience, is that there's psychotherapy methods like systemic therapy, for example, that is more effective than others because it's just looking at the whole system, family, society, within ourselves. So that's very useful, for example. And also that's why some insurances in some countries reimburse certain methods and others they don't, because they couldn't find enough evidence to pay for it. So that's also depending a bit on which country you're at. And then there is also, I think it's essential that you get somebody that has also trauma therapy. And to get somebody, which are most of my colleagues, fortunately, we find each other that are continuously in trainings. Like, if we love our job, we don't stop. There is one training leads to the other, one book leads to the next, and we continuously in a process, and we can apply many things, and we don't even put it on our website or. We don't have to mention it, because if we find like that could be useful, we use it. It's like having a big toolbox, and depending on the day and the moment, you use a tool. And then what is essential, what I would always look into, that we understand recently, is that you have somebody that is also trained in a bottom-up approach, which would be working with the body, working with the nervous system, not just talking. Because only talking, we know, is mostly not enough. It's important, no question, but it's so much more effective and more beautiful to combine it with also working with our nervous system and with how we're feeling and how we're sensing, and combining those two things.
Yes, this is also what I often hear is, yes, I did 10 sessions of ketamine therapy or 10 sessions of this and it did not help. Yes, because it was too isolated. You didn't look into the different areas, which we will hopefully dive into in a bit as well. But there is one big thing which is also on a global scale happening in the world in today's Western society. I mean, coming from a Lebanese background, we are much closer as a community, families, friends, and we see each other. We just see each other to watch TV together sometimes. It's not just to have an appointment like in Switzerland and the Western world. Now I in a year from
on
now
Sunday
I will have on Sunday at 2:00. I may have time for you. That's not how it goes. It's very spontaneous, and this is also how I live my life with my family. We never have appointments a month in advance. It's for me, I want to live now, and what am I in the mood to do at this point? But in the Western world today, we have loneliness as a big topic.
Absolutely.
And from statistics, we know that most from 15 years to 30 years, about 60% feel lonely today.
Yes.
So what is the cause? Why is this happening in this world?
Yes, loneliness is a big problem of our society, and it changed so much in the last generations, where the individual became so important, and it was felt to be something like a human development, to be individual and to make your own decisions, also to live in a city. People moved a lot from the countryside to living in villages or living in families to living in a city, in a small box. Like I sometimes say, everyone in his own box. And we know now that that's really not something that makes us happy and something we should look for, because we're mammals and we're social animals. We're developed social animals. We need each other. We know that from studies that were somehow even brutal when there were babies that were given food and water and medication and everything they needed, but no touch and no love, and they died. We know now that we really, really need it, and not just as a baby, we need it all our life. So that is really something that changed a lot in our modern Western society. Other cultures don't have that yet, fortunately. And also, what's really sad is that the trend goes even further. Like young people nowadays, since they have smartphones and this huge problem of social media, they tend to not even want girlfriend and boyfriend anymore. Like they're not looking for partners. They have less sexual relations, like less discovery, which was always part of growing up or becoming an adult, that you would be curious, about connecting to each other. So these things statistically even get more and more lost, which is really, really alarming for our whole society. And also, the community in general, there used to be community life of any kind. It can be religious, no matter which religion. It can be joining a club, doing sports. Most people don't have that. And if you don't have a child that somehow forces you to go to school meetings, even that some people don't do anymore, you might not do anything and have no community sense anymore. And the bigger the city is, the harder it is if you don't join a group, for example, to collect garbage on the beach or things like that. Those are modern options. But we know that community is a preventive factor for us. It gives us resilience, and we need to belong. We need to feel like we're part of a group and not part of someone else and something bigger. And that it's a very important topic, I think.
Yes, it's there are also differences, regional differences, as we know. I was just recently in the mountains in the Swiss Alps, beautiful, sunny, a lot of snow, and then in the mountains you have the cultural side. Everyone knows each other. When you walk across the streets, hi Sepp, how are you doing? So it's just these little interactions during the day gives you already sense of belonging to a larger community.
Yeah.
But once you enter into a city like London or Paris or New York, you get anonymous. So you cannot just say hello to everyone. People would look at you strangely.
Yeah.
So what would you tell these people who lack of connection or communities to do? What can they go out and seek to help them?
Well, other human beings as much as possible, to join groups. It can be anything: yoga, qigong, pilates groups, art, music, play in a band, play or sing in a choir. We know from studies that's one of the healthiest things and most preventative things we can do is singing in a choir. It's nervous system, vagus stimulation, and really healthy. And it's beautiful to be part of a band, for example. If you've ever had that, it's so beautiful. You're doing something together, or it can be anything. Or join the sports group, play on a team together, or do community work collecting garbage from a beach. I said earlier, I think that's also a beautiful thing to do even with children already, so that they see that we're supposed to care and we do it together, and it's not all lost and the whole world just getting worse. So joining groups, and then maybe also self-help groups if needed, groups where they have something in common, or where you might have a relative that has a diagnosis, or you yourself, anything that could be fitting to your life.
No, that's beautiful. I mean, any kind of interaction where you get out and be with people, but this step to get out, that might be a critical moment. But I think there are today also options and solutions online.
Absolutely.
If you want to try out online groups, help groups, or
absolutely.
I'm pretty sure there are singing groups online, or if someone wants to explore their karaoke experiences.
Or to meet at least. It's easier maybe to find it online, but then go there. For example, there are hiking groups all over the place, or language exchange groups of any language you like to learn or practice, or you want to offer for somebody else, these kind of things. Or working with animals, or working with people in need in an NGO, with children. There's so many options out there. It's really about making the first step and doing it.
What comes also to my mind is looking into mental health in general and regional differences, there is certainly an element of genetics versus epigenetics and what causes now all the types of mental health disorders today. Do you see also specific conditions which are more genetic related or more epigenetic related, like the life environment surrounding and our today's routines?
Well, it's still believed that some disorders are more genetically influenced. For example, autism, ADHD, mood disorders like depression. And then I think the epigenetics is the most important factor for most conditions or most struggles we have in general, because it depends so much on what we live through, how much stress we are exposed to. And I mean, also mental stress. Even it depends so much on how our own pregnancy was, what happened to my mother when she was pregnant with me, that I don't even fully know because I wasn't present there. But these things affect us so much. And then what happens later on, what happens in our life, and then if something gets activated or not, and if we have the resilience, if it's just getting too much and then we develop a symptom or a condition, or if we have enough resources and stability to cope with it despite. And so there's a lot more research now on resilience. So we want to ask the question, why is somebody not developing a disorder even though this and that happened to him? So that's a really interesting question. And I also think, or we know now that trauma, for example, is passed on up to 3 generations. We know that from studies. So what happened to my grandparents or even their parents might still have an influence on my life, but only if something else happens, and if I don't take care of myself, or if I don't have enough coping mechanisms and resources, and depending on many factors. But to just simplify it on genetics is usually not the case anymore, which is a good thing, because then we don't feel helpless.
Yes, they can certainly influence each other, genetic and epigenetics.
Exactly.
Like, for example, when I think about drugs or cannabis
Yes.
consumption and what it can
To some people.
do to some
Exactly.
people's brains, and or maybe someone would need to have some genetic elements, or then they can manifest in a
different way. Yeah. We do carry risk factors inside of us, that we might never know because we weren't exposed.
If we rely too much on genetics or something like a diagnosis, this is for me a big misconcept as well, that people think, now this is me.
Yeah.
I'm in the situation.
Yeah.
This is my life.
Yeah.
This is not going to change. They feel like stuck, maybe.
Yeah, helpless.
Yeah. But also the identification with the disorder, or the identification with, my parents had that, or my father is an addict, or my uncle, we have it within our family. What would you tell these people? Are there ways out?
Absolutely, 100%. I even saw clients that came with diagnoses like ICD-10. They would tell me, I have F63.2 and F10.2. Like, they knew even the codes, and they so much they identified. Or they would come with 0.5 meter of reports of other practitioners. You can read about me. And I said, no, you tell, let's just meet. Let's start over. No, definitely we can change almost everything. If you look at it, I love evolutionary psychiatry in that way, that if you look at us as a human species, we survived so many things. I mean, we were living in caves, we were living outside. Now we forget about that, and because we are all on our beautiful furniture. But we are built to survive, actually. to survive many things and to adjust and adapt. And that's the beautiful thing. So if we can take a moment, take some time and have a good therapy, including our nervous system, and process things that just accumulated throughout life, then we can change so much. And I would really go away, if we can, from all those diagnoses. We need diagnoses, of course, to reimburse still with insurances, for studies, for data collection, to compare, of course. But in the day-to-day, we don't really need diagnosis. We need to understand what's going on with someone, and we can tell them, okay, you have symptoms of this or that, and why. And we want to understand why. What might be the coping strategy behind it? Why did you develop those symptoms? And that's how we would look at it nowadays, if we have the time and
the resources to bring all the needed therapeutic elements into it. Because I also feel everyone has some type of symptoms of different traits or disorders, if we may say so. But and this is what makes us unique.
Yes.
So I always also tell clients, how can you expect just saying you are this bipolar or borderline or only ADHD? So they identify themselves also with this disorder later on. This is where I have a bit problem seeing happening, just to put the disorder on a person, and then leave them with it.
Exactly.
Or just give a medication and let them believe, this benzo will help you now. Or when you feel anxious, now take this pill. And that's not the right approach, from what I understand also.
Yes, definitely. Because then also these people feel like they need it, they depend on it. They feel like, if I don't take this, I'm not well. And that's not the way to go, actually. You know, medication can be great. I mean, without antibiotics, I don't know where we would be now. But we need that sometimes, but we don't need that to it doesn't replace like working on where something comes from. And that's the beautiful thing, because once somebody understands I have symptoms of, and not I am, then we can understand, okay, why did you develop them? And we want to validate them. That's also something that's really important for me. We want to validate. We don't want to say, this is bad, you have a pathology, you have a disease. No, we want to understand, okay, why did you develop this hyperactivity or this hypervigilance, these ADD symptoms? Why do you think did you need that? And then usually we see that it was a coping mechanism to survive psychologically. And that's what we made for, actually, to survive many things. And if we can take a moment and understand where it comes from and validate it and see that it was needed maybe in our childhood, maybe to make it through, to deal with something, then the whole concept becomes clear that, okay, I'm not this, I just developed it, and I'm much more than that, and that happened to me, and now I can change things. And
what it does, it empowers the person, the human being, to believe in themselves and to make a change. That's what I love about that.
Absolutely. And to become also more caring and loving, which is a big topic we should all learn in our society, but that they can understand, okay, why did I become that way? What was missing? What needs weren't met, maybe by my parents or by my surrounding? And then they get more compassion, self-compassion for themselves, and that's essential. Then they understand, okay, as a small child, I didn't get that. I needed it and I didn't get it. And then the question is, how can I give it to myself now? Who can I surround myself with? What can I do that is good for me? And we can change things. That's what we call also reparenting in a good therapy, that we are also supposed to do that until the client can do it all by him or herself. But that's what we can do even later on. We can give ourselves what we would have needed, partly at least, and we can change things always. We have immense neuroplasticity, what we know from psychiatry, which is beautiful. Our brain is incredible. If we have a stroke, we can learn everything over again. If we lose an arm, we can learn to write with the other. So why shouldn't we be able to change also other behavior and other conditions?
Yes, I think this will give trust to so many people that believe in the body can recover.
Yes.
It's like if you cut your little finger, it will heal.
Yes.
Probably. Yeah, it will have maybe a scarf, but it will heal. And the same is also with our brain and the connection, the neural connection. We will talk about that in a bit, hopefully, too. Simplifying a little bit the story of believing in what is underlying versus just believing on medication intake. I just had this morning, actually, a little conversation with one of my daughters who just turned 16. Yes, she's been not feeling so well the last couple of days, and then she was asking for a medication, like an ibuprofen, simple. And I tried to explain to her again also, look, you can suppress this now, or we can work together on how can we work on the underlying cause to strengthen your immune system. So let's understand that. And I think that's also something we need to try to tell people. Let us understand what is underlying to your current situation. What are the symptoms and where do they come from? And then we can do the right work.
Yes, exactly. Beautiful way to put it. Or like if we have a wound, we can't just cover it without cleaning it and letting it heal. Just cover it up with a Band-Aid, I'm saying sometimes, and not feel it, like what stimulants do with many ADD symptoms of children. Or one big example, we have many clients with that, and I think everybody, that with all these weight loss injections that are so misused now by clients, that instead of working why they're overeating to soothe themselves, they give themselves those injections where we don't know what the long-term effects will be in an abusive way. So that's, I think, another big trend we see recently.
I see it across different ages and also clinicians and doctors who use it. Where do you see the effects? Let's say short-term. We don't have long time data on the usage, but do you see any development or tendency?
Yeah, we do see already quite a lot of possible side effects, a lot in digestion, which is already a huge thing, without going into details now. But if we understand how important the microbiome is, the brain-gut axis, our digestion, for example, every functional medicine specialist knows that if we don't have regular gut transition, that's a risk factor. We're like somehow poisoning is a strong word. That's what they say. They're quite radical about it, but it's a risk factor. We shouldn't keep certain things inside of us and for a long time. So if this medication is like blocking our metabolism, and that's what it usually does, that's a mild side effect, that is already a huge thing, I think, for the general well-being. And then there's also side effects like kidney problems and mental health. People get depressive, people get all kinds of symptoms. So in general, it's again this quick fix, what we see in our generation and in our society. People, of course, we have all that medication with the first generations. To have all that medication there, of course, it seems great at first sight, but then we can't use it as a quick fix and just say, okay, I want to lose weight, I give myself an injection. I'm not a robot. Every gram of fat also has an immense metabolism of its own in my whole body. I can't just take it away and put, like, also if you do surgery, we have to work on it psychologically. We have to understand where it comes from. And really deal with it, to change it for good, and the diet and everything, and the microbiome and so on. But it's just that's also something, a big trend we see lately.
Yeah, I believe someone need to weigh out what is really, because overweight has side effects certainly on the body, short, long term, and using the medication, and someone need to weigh out what is less likely to be harmful for one being.
Absolutely. But what I meant now are the clients we see lately, they don't have real overweight. Some of them not at all.
Yes.
Some even underweight. It's really, it's being abused. So I think we really have to be careful as specialists to prescribe it.
Can it be mentioned or categorized as a tendency for an eating disorder today?
Absolutely. Yeah, I would even say maybe eventually we see it as another form of purging, that purging that people would also use laxatives or do whatever other thing to lose weight. I mean, it's another way of chemically influencing your weight, and in an unhealthy way, with the only purpose of losing weight. Yeah.
We can hope that long term we know more and we know better about that. You have spoken now so nicely about all the different techniques and areas of your expertise also. My understanding of psychiatry today, if I can summarize that, is the future integrative psychiatry. And can you just summarize this in your words, how you see it, and what elements should integrative psychiatry contain, and every practitioner or any treatment center should implement?
Mm-hmm. Well, I think what's important, and I understand that there can't always be one person like we talked about before, but it's important to not split the human being anymore, like psychosomatic, or just to see the brain and the body. And because that's just not helpful, especially in more complex conditions. So I think integrative psychiatry should always be looking really at the root cause of everything, and really seeing the whole human being, developed animal, as a whole, and understand what's really going on. And that in every way, that entails functional medicine with nutrition, the gut, for example. Then we have to also always keep in mind, of course, the story over several generations, if we can, trauma history. Really, really have to understand what does trauma mean. And the meaning of it changed completely, which is great, a great development. Now, recently, it changed completely to what it used to be. And we need to understand that trauma effects can be so different, looking so differently, and we really have to detect it, and we really have to understand it. And which comes to the next thing, the so-called bottom-up approaches. Now we know that the vagus nerve going through, connecting our body, the organs, the gut with the brain. We know that this nerve is immensely important for the parasympathetic nervous system, for everything that we call also being relaxed, being calm, being curious, digestion, relaxation, and so on. So this nerve that we want to actually influence, all of us, because we want to feel relaxed and we want to sleep well. But in this nerve, we know now that 90% of the information goes from the body to the brain, and only 10% goes top down. Some say 20, but it looks more like 10, which means that in evolution, like our setup is towards, this is not so important. This got incredibly developed throughout evolution, too developed. I think we really have to learn how to handle it. Also, we get a lot of very intelligent patients, which I love about our work as well. So what these people have to learn is, it's like having a racing horse up there or a Ferrari. You have to learn how to drive it And you have to learn how to turn it off, else it just does what it wants, and we can't sleep anymore, and we can't stop overthinking. So if we understand this, and that the 90% information goes from the body, then we can influence it, the nervous system. And if we do that as a psychiatrist, as a somatic experiencing practitioner, as any therapist that is trained in bottom-up approaches, can also be a body therapist that does yoga or qigong. If we influence this, then the nervous system signals to the brain, everything is good, we're safe, relax. And that's what we want to have, all of us. That's what we do with our children. Nobody needs to tell us that. We do that naturally. When a baby cries, we hold it, we soothe it, we calm it down, we co-regulate it. It's nervous system. That's called vagus stimulation. And that we have to understand. Because if we don't do that, we're always just working on the surface and we're trying something. It might work, but it might not. And it's also using time. A lot of clients get really frustrated because they tried so many things, and they might end up thinking, okay, I've seen so many therapists, I've tried so many things, I'm hopeless, I'm helpless, nothing works. But it's just not true. It's sometimes, most of the time, it's that link is missing.
So what you're saying is integrative psychiatry doesn't just focus on the brain, on the mind, on the mental side, but it should also integrate the body from inside out, as well as the nervous system, how it's connected. What other elements would you see as part of integrative psychiatry today?
Yeah, actually, almost everything. If you think about most mental issues also have a lot of physical symptoms. Like our clients usually have problems with digestion, with sleeping, with pain, any kind of physical symptoms as well. So we do need to understand, and that is usually a sign also of the nervous system being not regulated, and it's very important to approach it that way also, and not to split it apart. And another part of integrative psychiatry can also be to spare medication or to help clients that don't respond well to medication, which there is a big part of it as well, is to use modern devices and to be trained, for example, in direct current stimulation, in neurofeedback, or in TMS, or using polyvagal informed therapies like the Safe and Sound protocol, all these kind of modern things that are out there that are very effective, with barely any side effects, so really safe, and a great alternative and option if people have knowledge about it and access to it.
Yeah, so you definitely add then some technology-based treatment. I think as a category, this is called neuromodulation, and there are different techniques today someone can access. Additionally to the traditional talking therapies, medication-based treatments, but also the holistic. I fully understand it. It's logical to me that we have to look today at the person as a whole, and not just to isolate the mind and this is this, or the feet or the pain. So it is definitely holistic and integrative. And then I have my own experience. Back in Switzerland, I had my own struggles where I was hospitalized myself when I had a heart attack, and then after that was still my early days figuring out what happened to me, why did it happen to me, and then I was pushed from one specialist to another, and everyone looked at it so isolated. Like the cardiologist said, "Yeah, everything is perfectly well with you." But I don't feel that way. What if it happens again? So there are a lot of anxieties came up, and lot of maybe symptoms I felt I have, but maybe it was just mentally, and I needed to figure out where and why. But I did the hard work to go and search and speak to people, and I didn't feel well taken care of, in the sense that one hand or one source helped me to look at myself holistically and understand myself. And this is, I think, what in today's healthcare system is missing. They work to isolate it, or they push from one side to another. Maybe you have some experience with your type of clients as well?
Yes, definitely true. I mean, it's also partly because there is so much knowledge now. I mean, it's not even, for example, that one cardiologist is just a cardiologist. Now they've specialized, because it just doubles and triples all the time, everything they need to know. So it's impossible for one specialist to know it all, or to keep up with it.
Yeah.
And then we're supposed to keep on being in trainings, and it's just impossible. So I think what's missing, what used to be the case, was a GP, like a general practitioner, that would overlook it. And that's not the case anymore either, because they don't have much time, and it all has to be quickly done. In the countryside, it still works. There's still general dog practitioners. They would go to the home of somebody. They would know the children. They would even deliver it. That's beautiful. That's also a connection to a family. But those things are rare nowadays. So maybe there should be the function again of somebody like taking over this role of putting the information together and seeing the integrative part of it.
Yes.
Because the tendency is there in all specialities. We want to look at it more integratively, but who connects them between each other? So the beauty of psychiatry nowadays is also, I think, that we see the clients after they've been at all the specialists you mentioned, because then one will say, okay, I don't know what to do with you anymore. All the values are good. Go see a psychiatrist. Also because they don't know what to do anymore. And then that's then when that ends usually. That journey of checking doctors and trying out things. That's when it usually ends. We can also have that role, but it shouldn't be that way. Of course, that somebody has to go through so many spots.
Yeah, but I'm today more and more. I mean, what I've been talking about is many years back now, but today I see more and more psychiatrists with further educations in psychotherapy and functional medicine, and more holistically oriented as well. And I think that's some sort happening, but you need in the first place to get to a psychiatrist or
to know what you're looking for.
To know what you're looking for.
Exactly, absolutely.
So if we look at the nervous system, because the nervous system, especially with traumatized people, anxiety and other disorders, it plays a big role.
Yeah.
How is someone who's traumatized feeling, or how is the nervous system playing a role here?
Well, usually what we see a lot, and what we all know more or less, is that a trauma is not how we used to see it, like something that happened. It's not about what happened. The same thing, two people can be in an accident, and one afterwards develops symptoms and the other one doesn't. So it's not really about only what happened. It's about living in the here and now, inside of our body, inside of our nervous system, not living safety, living as if it was still the case, as if I was still in that moment, still being threatened by something, or by an accumulation of stress and things that happen. So what we usually see is that the nervous system is either overactivated, which could be, the typical fight and flight symptoms. People would come with anxiety, with feeling stressed, unable to relax, to stop thinking, ruminating, not being able to sleep, thinking about problems at night, maybe changing, not being curious anymore, not feeling like relating to other people anymore. These kind of sympathetic symptoms, we call them. And then there can also be the typical shutdown, if we simplify it now. People that would feel like, okay, maybe I've tried to fight, or they wouldn't call it that way, but I've tried a lot, and now they just feel helpless, and they feel like they're in a shutdown, which could be a way of seeing depression in a way. Like depression is somehow also seen that way, a state where somebody loses interest in things he usually likes to do, or going out, or connecting to people, or trying new things, and just shutting down somehow. Or even the posture, we see that sometimes in people, like they have less expression, sometimes just feel like, the tonus is different. So that's what we usually see when we speak about the nervous system. And then there can also be these more complex states of having a mixture between it, which is quite confusing for the clients. They can be from one moment hyperactive, overactivated, stressed with the heart rate up, going into shutdown, dissociating, feeling completely numb and disconnected, and not knowing what's going on, and then maybe jumping into the next state again. And so like we call it dysregulation of our nervous system. And that's what we see a lot especially in traumatized clients.
How can someone connect with this or regulate this by themselves? And when is a practitioner needed to help that person?
Well, we can do a lot ourselves, of course, which would be anything that is good for us, which is we can call vagus stimulation, or however you want to call it. Can be anything with breathing. If somebody likes to do breathing meditation, qigong, yoga, sports, a little bit of running, but slowly. It's not about overdoing something again. A lot of nature, connecting to nature again, being in a forest, for example, I think is one of the most rewarding and healthy things for me. And taking care of the body, not just sitting there. We have the tendency in our society to just sit there. The more problems we have, the more we just sit there. We're frozen with it and we don't move. But our nervous system is still the same as many, many years ago. We're supposed to move. We're supposed to fight and flight. If there's a tiger in front of me, I'm supposed to do something about it. And my nervous system doesn't get it, why I'm just sitting there frozen with all my problems in my head, because the problems have the same effect as the tiger in front of me, no difference. So we need to work with that. We need to let it out, to simplify it, and do movement, get into action again, but not overdoing it. Some clients also have the tendency then to try to help themselves, but then they overdo it. They're like sensation seeking, and they start bungee jumping and motorcycle racing, and they disconnect more and more because they have more and more extreme sensations. And that's not the way to go. So to answer it, we have to go really slowly, like we call in chemistry titration, one drop after the other, slowly, and then give our body time to adjust again, to work with that.
Yes. No, that's I think what is missing, just to have the right balance, to jump or not to jump, to take little baby steps from one state to another.
Yeah.
But what comes into my mind when we now speak about the nervous system, what is the cause and the effect? So what is the nervous system shut down an effect of what? And does it have effect on different things? If this question makes sense to you?
Mm-hmm. Yeah, I think the cause is usually always trauma, but like trauma now in a wider meaning. Trauma can also be, for example, a question we always ask, how was the birth? For example, sometimes we see clients that are really dysregulated and they tell you, everything was fine, my childhood was fine and everything was perfect. And then you ask, but I see that your physiology shows me something else. So how was your birth? And then they say, I almost died. the cord was around my neck. I was blue. I almost died. They had to reanimate me. I almost didn't make it. That is a trauma. It's and even smaller things. And these things leave already body memories inside of each one of us. And that's normal. We're built to survive most of it. It doesn't mean that we will have a problem. But what we should understand is that we're piling up charges. We're piling up tension inside of our system, throughout our own history. Like wood, you could see it like wood if you want to make a fire. Like more and more wood is piling up. And it just can be that there comes a day when it's getting too much, even if it wasn't a specific great thing, the event that happened now compared to everything else. But it was just getting too much for your nervous system to regulate itself, to cope with it naturally. And then we really need or should get some help with maybe a somatic experiencing practitioner to work through that carefully, and not try to stress ourselves even more, with some kind of methods that we sometimes tend to seek help with. So that's the thing, to do it really carefully, like to take one wood after the other, and then they're all connected anyway, and discharge and help our nervous system to bounce back into the resilient state that we all can be at, and like dogs and cats most of the time. And there's a lot of beautiful techniques and methods we can do. We can support that with, and we can learn also to do at home. And things like I mentioned before, everyone that has a child or had a baby ever naturally knows what it means. We never thought about it, and nobody usually explains it to us. We do that naturally, but that's the same principle. We have to regulate the baby because the baby can't. It's screaming, and we don't even know at first, is it hungry? Does it have pain? Is it tired? We don't know. It doesn't matter. We want to regulate it, co-regulate it. And that's what we need to do for ourselves, because we need that all our lives. And the less we pile up, the easier it gets.
Yes, when I think about trauma, and you mentioned it, that we save it in our body, I think about the sponge, which everything we experience in life, we take it into us, and then the release of it is like letting pressure out, not to overwhelm the system. So always like to have the right balance and the right play between letting out and
yes, exactly. And that always in a safe atmosphere. We should never forget that, because trauma therapy used to be more intense in the beginnings, which was important in development. So a lot of people are scared, and they think if I go into a trauma therapy, then I'll be exposed to my worst moments. That's not at all what we're doing anymore. It should be really always on the basis of really secure, really stable relationship with the therapist. So one thing I really want to mention also, is so essential to be regulated as a therapist, because like with the baby, we are co-regulating each other all the time. Sometimes we don't notice, but we even detect more than 1 meter if somebody's regulated or not. That explains why sometimes we feel more interested in getting to know someone, and sometimes we don't. We might not even think about it. Or sometimes dogs would bark at one person and at the other one not, and nobody thinks about why. But it's really interesting. It's this dysregulation we notice here in a neuroception level, completely unconscious. So that's already part of a therapy, where nothing has to happen. We don't even have to talk much, but just regulating to another human being is already really beneficial, and can be such an important step for a traumatized person to feel safe and feel okay with somebody, and then build on that trust, to carefully exploring and lose the fear of looking inside and of keeping it together, and maybe even dissociating already out of fear and disconnecting from everything that's going on. So it's a really beautiful process, which I'm trying to say. So trauma therapy, I was really surprised in somatic experiencing, you deal with the topics are like the most horrible trauma you can possibly imagine. That's the kind of clients you get prepared to work with. But even though it's so negative somehow, what happened, what human beings can do to each other in war crimes, in all kinds of horrible situations, the message is so beautiful. It's so positive, and everybody that did that training is so believing in that, is living that in this positive way of out of it, and really being part of that journey is a beautiful thing.
I met a while ago Peter Levine, and I know about his work, and he's the founder of Somatic Experiencing. But I know also that somatic experiencing can be trained by anyone. Yeah, you don't need to have specific education or background to do it. So from my experience being with clients and talking also to different types of specialists and therapists, I feel I feel that some combination is needed, because it cannot be just isolated, just somatic experiencing by itself. What is your experience working with clients, and what is the essential combination or to be added to be successful?
Yeah, I usually agree, especially with our patients, because of course, once you have a problem, like a mental condition of whatever kind, or you are traumatized, it's absolutely essential that it's
Like in more complex cases.
that you have a combination. That the best thing is always that your psychotherapist or your psychiatrist is also trained in that and can just be there whatever happens. It's also something beautiful to live through that. I hear that a lot, that they feel like I can cope with anything, whatever comes up, no matter how dark and scary, no problem. We're trained in it. We can deal with it, with whatever comes up. And then they don't have to be worried about it anymore. And with somebody that is not trained in anything but somatic experiencing, coming more from a body therapy area, there can be a really difficult moment when that happens. So that I wouldn't recommend. But for clients that are not complex and not traumatized, I think it's actually great that the more people are trained in it, the better. I mean, the more understanding, the better, because I think most people that do that already do parts of it with their work, like massage with touch, or craniosacral, or rolfing, all these kind of things where you're so close to somebody, you can really, things happen. People start crying sometimes just by being touched. Yes. and things open up without even knowing it. So it's beautiful that they can go deeper then. But I also think it's really important if somebody's not stable enough, to first refer to somebody with the whole training behind it, and then maybe take over later again. Yes. And see it that way.
Great. You also mentioned something which is fairly new in the psychiatry field. It's the neuromodulation and the different techniques. Mm-hmm. Can you explain what techniques are out there? What are the differences? What do you prefer? And for what cases they make sense versus other traditional methods?
Yeah. Well, I think it was a huge improvement in psychiatry. There used to be the famous electroshock that we know from some old movies, and that's quite invasive for people, and they're also quite scared of it. So coming from that, maybe to start with, there is nowadays something called direct current stimulation. And this is really, really great methods, especially for patients with depression, also with chronic depression, with depression that, clients that tried many different medication already didn't respond to it, or patients that don't want to take any medication. out of whatever reason. And it's something that is really effective. Level A evidence from the World Health Organization. That's the highest evidence there is. So we know it works for most people, and that without side effects, barely. Like if people drink enough water and keep hydrated, they have no side effects. If they don't, they might have a slight headache. I tried it myself. I always try everything myself. You barely notice it. You have a small current here, and it's like a tingling, like as if you would have a bug in your hair. Yeah. And that's all you feel. Usually you only have 10 to 15 sessions, 20 to 30 minutes, and you get significantly better. It's also working really well for craving, for addiction, for some OCD clients, for a lot of neurological clients after stroke, when they still have problems with finding words or other kind of impairments, cognition, also for acoustic hallucinations. There are many protocols, and it's continuously evolving. And it's also quite interesting. It's neuro enhancement. So we know that after an hour afterwards, our brain is stimulated, that we have like a window of opportunity. So we can memorize better, we can think better. So we could use that time. I'm always trying with our clients to do something useful afterwards, like to learn something they want to learn, or do some mindfulness exercise or something.
How long is this time window of?
An hour about.
About an hour. Mm-hmm. And do the, let's say, TDCS, that's what you were talking about, is it helpful just by itself? Just someone go to TDCS and this should help? Or does it have to be combined, let's say, with psychotherapy or other techniques?
Well, we do it, of course, it's done by a psychologist or psychiatrist. And while we do, we talk. So we use that, especially the hour afterwards. We should use it for a therapeutic purpose. But it is effective in studies by itself also. But in general, of course, we shouldn't do, we always want to have the whole package and see it integrate. Exactly. Yes. So that's what we do also. But it's really great, a great option and a great new innovation, and safe and effective, which is really good. And then there is transcranial magnetic stimulation, TMS, which is also a great development for patients with major depression or chronic depression, or for OCD, or also for people with sleeping problems, insomnia, and addiction craving. And more focuses are also part of research. So TMS is something that you can apply. Usually you do it with a psychiatrist in his practice or in a medical center, and you just sit there and you have a coil with magnetic stimulation. This is quite big and quite loud, so it's not something everybody has, like the TDCS. It's handy. You can take it anywhere. You can even go on a home visit if needed to the client's residence, and or outside or wherever you want. So the TMS is the bigger device, so to say. Okay. So it's usually done in hospitals even, and a lot of research done. And then there is neurofeedback, which is very important, especially for the whole topic of children with ADD or ADHD symptoms, because it would be the treatment of choice. And most people don't know that. So they haven't even heard of it, even though neurofeedback would solve the problem long term of somebody not being able to focus or having attention problems or sleeping problems. So if we know that, and if we see that, for example, stimulants only are effective while we take them. If we would stop taking them, we have the same symptoms. It's only symptomatic while we take them. So, and neurofeedback is the treatment. So we should really spread that information, and a lot of healthcare systems now reimburse it even and have programs, because of course long term it's so much better for the children to not take medication, not depend on it, and really get better and avoid all the long-term effects of somebody with ADD or ADHD symptoms that usually then later on feel like they have problems at school and they have low self-esteem or other kind of problems. So neurofeedback is something really easy to summarize it, really easy to do. You sit at a device, it's like a computer, you have electrodes on your head, it's like a real-time EEG. And you see your brain waves and you see them in a software that is adjusted to your age. It can be more like a game, or it can be just in colors, or it can be music. So you learn how to influence your brain. It's like biofeedback, where you learn how to influence your blood pressure, for example, or your breathing. You learn how to influence your brain activity, which is really great for all of us, because we learn, in the end, we learn self-regulation. We learn how to activate the brain and focus if we want to, and how to deactivate and relax and sleep and whatever we want to do when we want to, and how to switch between those states. And in the end, everything is in life, if you want to see it that way, is around that. We constantly in different states and activation mode, and we can really benefit from that. And that's again the neuroplasticity that is immense. We can really use other parts of our brain. We can have a better connection, because we believe that in psychiatry that a lot of problems are network problems, that maybe two networks don't work perfectly together, or one is inhibiting another one. So we can influence that, and quite specific and detailed to everybody's needs and everybody's EEG. So that's a great development. Also evidence-based, high evidence, incredible evidence also for anxiety, for sleeping problems, and also very, very safe, no side effects, which is a beautiful thing. Also not a standalone therapy. It should be part of a psychotherapy, where you also speak, of course, with the therapist before and after, and understand, how they can incorporate that to their real life, how they can use the new skill, this implicit skill, implicit learning, like learning how to ride a bike or play an instrument. You learn it by doing it, and you shouldn't lose it again, which is beautiful.
Yeah, so there are beautiful techniques which are out here now, which can replace, in some cases, medication, which have potentially long-term effects. But I'm also pretty sure it needs more education or knowledge on the practitioners or therapist side to define which one to use in this moment, or for what case, or what combination of therapy environment someone should have, because that's the next level of individualized care. Looking forward, how our field of mental health and holistic integrative psychiatry may lead to the knowledge to define what is the best combination of treatment for this specific person. Because at the end, just giving information can also be sourced these days by ChatGPT or other AI solutions, but that might be, as of now, at least. Talking about individualized care, and I'm very passionate about individualized care because I had my personal experience, as I shared before, where I wanted to have one source helping a human being on a 360 degrees level, holistically, as we say. How do you see the benefits, or where do you see the benefits of treating one client at a time in a residential care versus a community-based or small group-based therapeutic environment?
Yeah, it both has its benefits. I would say that the individualized care, of course, has the huge benefit of adjusting 100% to one's needs. So that is that is beautiful. Of course, if it's possible, it's beautiful, especially initially, to really have that time, have thorough assessments, really getting to know the team, building up trust, which is a major topic for most clients in that, especially when they come with trauma history, which are most clients nowadays. So that gives us an immense benefit, especially when it comes to feeling safe, which is, again, we talked about it here on an unconscious level. But if we are somewhere and everybody takes care of us, and we can start trusting, we can start letting go, and maybe letting go also of defense mechanisms or being frightened, and really being able to open up and work on deeper topics. So that can be very important for most clients, essential even, especially in the beginning, to feeling safe, to feeling like we can really adjust and we can really understand and maybe adjust day by day to the needs of somebody and to the speed of somebody. With the program and with everything around it, and the diet and the rhythm, everything. And then, of course, we know also from studies and experience that we are, like we talked about, social beings, and community can be very effective. We learn from each other, so it can be great to also join a group, maybe sometimes once ready, and feel the effect of also being in a group, or joining also group sessions, or doing like we do at our clinic. Sometimes they do certain things together, like a yoga class or a hike. Like also sometimes it's really good to do it slowly, like to increase the contact with others and the community, like to get used to it again and to feel comfortable with it. And then also to be able to work on it in individual sessions, like what happened, how did I feel? Maybe it was frightening me, or it was stressing me somehow, and not overdoing it again, but really working on it right away to feel more comfortable with it. So I think that is a great opportunity to do so. But then there are other clients that might not be so complex, where from the beginning on, they would like to be in a community because that's where they learn most and from each other. Or also programs like around addiction can be really useful sometimes.
To see other also struggling.
Yes.
So there is definitely not one size fits all.
Exactly.
In that field,
Absolutely.
there are benefits here and benefits here.
Yeah.
But what I understand is the individualized side of care, with eventually part more as one client setting, and then a combination of being with others may be helpful.
Yes. Because also about the individual care, most people never had it and might not even understand that that's where some issues come from. But they would feel then the first time maybe that they're really taken care of, that they're really important, and like 100% from every angle. And that's a really beautiful experience, that there is so much time for me now. No, everything is possible, and everybody cares about me really getting better. And that can also be a healing experience, to really be important for once, and to really feel like somebody has time, especially in the healthcare systems nowadays, where after 20 minutes they start looking at the watch or type in the computer, and it's clear time is over. Unfortunately, the next one is waiting. So that can be really, really important also. And would be interesting to explore that further one day.
No, beautiful. And I think individualized care, as I said, is will be the future. More and more organizations are jumping into this to look at the person as a whole. So, wrapping things up for today's show, is there a book you think about which could be interesting for everyone out there listening to our show today?
Yes, definitely. I would like to recommend The Anxious Generation by Jonathan Haidt. Absolutely important to read it. Not just for parents and teachers, because it's a lot about the threats of social media, about what it does to our children, but also for everybody in general, because it shows really beautifully how our society changed from play-based childhood now to digital childhood, and our in society in general, how we became so much less community based, like we talked about, which also means people are more frightened, not just more lonely, but more anxious about everyone. We don't even know our neighbors anymore if we live in a big building. And if they look at us, we might think, what do they want from me, or what problem do they have? So this is a incredible development in our society that we should do something about. So I really, really encourage everybody to read it. And it's immensely interesting also to think and check and be critical. Every one of us, what does the smartphone do to us? How did it change our life? How much is it dictating us and not we, the phone? And how much does it decide about where our attention goes, where our time goes? I encourage everybody also to check the use on the phone, where you can see how many hours you used your device and what you did with it. We have to be so careful with that. It's really, we see that every age. We have people 75 plus that become so addicted to it that they get a divorce from their wives and they can't let go of the phone. So no age is protected from it. And we really, really should do something about it as a society and be critical.
So you would suggest actually to everyone to do this time limitation on their phones, not just for their children.
And be critical about it, all of us. And ask, for example, again, how often do I still read a book, or how often to disconnect and relax, which is not in the end, we know that. Do I just use the phone instead? And to really we have to be really critical about it. Like about wine, how often do I drink? We are also critical about it. When we drink a bottle of wine every day, every one of us would honestly think, I think that's not the way it should be. It's exactly the same way to think at it, look at it. If I'm on it more and more and more, and if it distracts me, or if I open the phone and I want to check my mails, for example, but while I check my mails, I get so many notifications and other things that catch my attention that is just not the way it should be. And our brain can't take that. It's just too much for us. It's making us all have ADD symptoms, all of us. There is no way around it. And we have to be really strong to say no and put limits to that.
And if it's difficult for us adults to do it, then I can imagine also how it must be for our children. So
Absolutely. It's our responsibility.
It's our responsibility to act on that and to observe that and explain, and not just through rules and limitation.
Exactly.
To give them the understanding why are they. Do they have to reduce their use of social media or phone technology?
Exactly, and be good role models. And
always.
also the governments, they need to protect. In the end, like it used to be we talked about it earlier with smoking. Smoking used to be no problem, even on planes. We had long distance flights and we're just with other smokers in a small room. And nowadays that's unthinkable. But it's exactly the same. We need regulations, we need protection, we need clear
limitation. Like some countries, they have developed like phone use or apps, certain apps not to be used under 16, the age of 16, and in some countries or in some public schools to forbid phones, but it's still unfortunately not everywhere the case. I'm getting to an end, so you have come across a lot of patients, clients you have been working with in the past. How is this affecting you as a human being, not a psychiatrist or a therapist? And what do you do to stay in balance in your daily life?
Well, I think I'm growing through all our clients. I learn from everyone. And I'm really lucky that I get so interesting clients from all over the world, different cultures, different backgrounds. So I learn new stories all the time. I don't go to the theater anymore or to the opera. I get that usually in my work already fulfilled. All the beautiful stories I hear, all the information about their life. It's very beautiful that my clients really want me to understand them. So they really explain, and I really listen with not just with my head, but with my nervous system. And that is a really beautiful thing. So I would even say, I would go that far to say that usually my job is not how it used to be anymore in acute psychiatric ward, which is a lot of tension and it's really difficult. But now it's the opposite. It can be really beautiful and it gives me something also. That's how it should be, a co-regulating, beautiful connection between two people for an hour or 90 minutes where we together try to make things better, which is a completely positive and beautiful way of thinking about it. So that's one thing. And then the other thing, I connect a lot to nature. For me, nature, and we know also a part of the book that nature is so much more powerful than we are as humans. So if we are in a forest, for example, we can't analyze the leaves and the greens anymore. It's just too much. So we just leave it as it is and realize how beautiful it is. We don't have to analyze it anymore. So it's really interesting if you look at that. So I really need nature. I go every morning for a run, but not fast, more like co-regulation type of bilateral stimulation, and connect to nature, spend time with children, spend time with positive people around me, and do many things that I feel like are good for my nervous system.
I have one question for you. So what would you give everyone in the world, or what would you suggest everyone in the world to do if you can reach out to them?
Slow down. I think we should all slow down, and we have to remind ourselves every single day because life is so fast.
This is beautiful. It's like being on a mountain somewhere in Italy, and just you see these old people sitting at a chair at the side of a road, and just watching the other people walk around.
Yeah, they don't need to go in a mindfulness training.
No. Beautiful. Thank you so much. I appreciated talking to you a lot today.
Me too.
Thank you very much for all the work you do.
Thank you so much.